I'm Dr. Mike LeNoir, and this is the Wellness Watch. Good health and welcome to today's edition, a special edition of the Wellness Watch. We have a very distinguished panel for us today, talking about a very relevant subject, COVID and influenza vaccines in the African American community. Do we need them, and do they impact allergic conditions? Let's have a conversation with the community medicine and the public health physicians and allergists of the National Medical Association. Our distinguished host today is Dr. Thomas Scott. Dr. Scott holds a number of credentials. He's a fellow of the American Academy of Allergy and Asthma and other sections. He is the chair of the allergy section of the National Medical Association. And as importantly, he's on the board of directors of Meharry Medical College. Practicing in the state of Alabama, Dr. Scott adds a number of credentials to the mix, and then certainly is the appropriate moderator for this discussion. Dr. Scott, welcome to the Welcome Watch.
Thank you, Dr. LeNoir. So grateful to be here and thankful for this platform so we can communicate important, vital information to our communities about how to stay healthy, especially in this time of trouble and pandemic. We have some very exciting speakers here today. Dr. Yutube Effiong is one of our speakers. He's the chair of the Community Health and Public Health section of the National Medical Association. He's an internist currently in New York, who formerly was in Michigan. And he has a wide-ranging array of talents and interests, not only in terms of healthcare, but health policy, health systems administration, addiction management, infectious disease, and global health. So we can bring him on now, and I'll introduce, Vice Chair, Dr. Asia Harris, who's a family medicine physician, currently practicing in Flint, Michigan at the Hamilton Community Health Network. She does yeoman work addressing issues affecting that community, which is also her hometown. Dr. Asia Harris. Third illustrious panelist is Dr. Nancy Joseph. She's the Allergy and Immunology Section Vice Chair, currently practicing in Massachusetts. And she's a native of Haiti, and she has joined our section and done yeoman work and has maneuvered herself into leadership, and we're happy to have her here to talk about influenza vaccine and allergy as it impacts upon vaccine management. What I'd like to do is to start by allowing Dr. Effiong to talk about his topic for a few minutes, and then we'll converse about that and then go on to some of the other topics. Dr. Effiong.
Thank you so much, Dr. Scott, and thank you, Dr. LeNoir, for having us on the Wellness Project. Today, I would like to touch on a couple of topics, and I hope at the end of the day, we come out with a couple of ideas. Number one, COVID is real. Number two, African Americans bear the brunt of this scourge. Number three, it doesn't have to be this way. 4, what do we do now? And 5, what do we see for a world without COVID, or for a world beyond COVID? I hope at the end of the day we're able to, end up with some ideas about this and get something home that will help us better with our lives.
Dr. Effiong, why is it this way? You said it doesn't have to be. What's in the way of getting this problem tackled in the community?
Well, that's a very good point. A very good question you make. So starting off with the fact that we agree now, the science is clear, COVID is real. The numbers are real. We see that African Americans are getting, whipped, disproportionately with this disease. And we know why that's the case, right? We know historically we've been not just underrepresented, underappreciated, undercared for, but also we've also been mistreated in such a way that has led to so much distrust. In the American community, very understandably, we distrust the health system, but that distrust is in its way, in itself, serving us wrongly when it comes to a pandemic like this. Now, if this were not a real thing, we would see we could get away with it, but it is a real thing, the real virus that is affecting us disproportionately because of historical inequities that have been there. Now, the question now becomes, what do we do going forward with the mistrust that we've had? Well, that is where the science and relying on the science and relying on real information, good information, true information comes in.
Well, I know that people talk about Tuskegee and we have all of these conspiracy theories, but aside from that, what are some of the other barriers that are keeping people from obtaining adequate treatment and from getting vaccinations?
So Tuskegee is one of those real things. Just as COVID is real, Tuskegee was a real thing, right? So who would think that the CDC or the National Health Service Corps would infect people with syphilis and not infect others with syphilis? And the people who they infected with syphilis were Black people, Black men, right? And not treat them with medication that was available, so that at a point the people were ending up dead or ending up with chronic diseases or chronic complications that came of things in the name of a study. That was a real thing. And the effect of that, the impact of that reality lives with us today. It is one of those drivers of that mistrust. But we have to move beyond that, because as much as Tuskegee was real, well, the real thing is that we have a real virus here, and science has moved beyond such crude methods of treating people as though they had no humanity. Now we know that the CDC, the World Health Organization, and every organization that does any research at all has to do with humanity in mind. And so we know for real that science is now being done in a more benevolent, humanistic way, and the results can be trusted. So trust has been earned. Now, beyond the fact that that trust is available, well, there's other things. Well, when this whole pandemic began, there was issues around, well, who gets vaccine and who doesn't get vaccine, right? Who is doing those jobs that put them at risk the most? And it turns out that, well, the underrepresented minorities tend to be the ones that are in the forefront of those businesses, those jobs that put you at risk. They're the ones that have the issues with health in the first place that put you at risk of poor outcomes. And so we have to deal with this as a very broad based problem that goes back in history, but also has issues in our current reality, given that we're still community things that have to be done in the community to improve health and therefore improve wellness.
Well, I want to come back to that, but at this time, I'd like to move on to Dr. Asia Harris and get her perspectives, which I think are a little bit unique and rooted in things that people can do to empower themselves in terms of preparing for not only this pandemic, but the next. Dr. Harris?
Yes. So I just wanted to briefly talk about the importance of nutrition and its impact on COVID infections and people who possibly get infected with COVID. So healthy eating can help strengthen immunity and decrease our risk of heart disease, diabetes, cancers, and other medical problems. And boosting and strengthening our immune system helps provide protection against many illnesses as well as infections. And it also influences our recovery process when we do get sick with different illnesses or infections. Having a balanced diet is one way to improve our immune system. And when I say balanced diet, I'm talking about lean proteins, whole fruits, vegetables, and plenty of water for our system. But if you aren't able to have a balanced diet, then vitamins and supplements are able to bridge that gap until we are able to improve our diet overall, as well as limiting foods with extra sugar or saturated fats, as well as sodium, can also help improve our diet overall. African Americans have a higher rate of cardiovascular disease, including heart disease and diabetes in the United States. And these diseases are linked to what food we take in and how our nutrition is. And chronic diseases overall can negatively impact someone's immune system if they aren't taking care of those chronic diseases, either preventing them or managing them in a general way. And that makes you more vulnerable to complications when you get illnesses or infections like the coronavirus. So having a good nutrition is very important to build your immune system, as well as help protect yourself overall from everything in your community, as far as you being exposed to things, as well as protect you from complications to infections like coronavirus. So good nutrition is a way to build our immune system and protect ourselves from complications related to different infections like coronavirus.
But Dr. Harris, are you saying I can't have my ribs and French fries, cherry soda pop? I mean,
I'm saying
does that food suppress my immune response?
I'm saying that the best way to build your immune system is to have quality foods that are high in nutrients, that are low in sugar or have natural kind of sugars as far as fruits, have high fiber content, have high vitamin and mineral content, because these are the things that will build your immune system, that will help protect you from getting different illnesses that cause you to get sicker when you have infections like coronavirus, or protect you in the sense that when you do get an infection or illness, you're able to fight it off better than you would if you had a poor nutrition state.
Well, I agree that the baseline and the message, one of the things that COVID exposed was that your baseline health status matters, being healthy matters, and that's true anyway with any chronic condition. But when these pandemics hit, whether it's the flu, whether it's COVID, if you're in suboptimal physical condition, you're gonna take a hard hit, and it's gonna be difficult to recover. COVID has exposed so much, and I believe that while it's done so much damage and continues to do damage, we still overlook some of the things that are still around bothering people. Influenza is still an issue. Dr. Joseph, can you talk a little bit about influenza and influenza vaccines and allergy and immunology?
Certainly. Thank you so much, Dr. Scott. Actually, that's a great entry. A lot of people are, getting their COVID-19 vaccination, which is great. But also remember, also get your flu vaccine. Now, of course, we're talking about, I want to talk about the importance of that and later tie that into the allergic diseases. So when we're talking about the influenza vaccine, earlier, Dr. Scott, you talked about the importance of just generalized good health and keeping yourself in best health that you can. Part of getting yourself in good health or keeping yourself in good health is getting your vaccines. In the 2019-2020 influenza season, only 41.2% of the non-Hispanic Black population got their influenza vaccine. So, that's a low percentage, but influenza is still out here. And so when we're talking about tying that into allergic diseases, simply put, influenza virus is a virus. And one of the most common triggers of allergic diseases, more specifically asthma, is a viral infection. And in fact, you're still at risk of being hospitalized, adult or children, with an influenza infection. And having an allergic disease like asthma definitely puts you at increased risk. And tying that into the African American population, African Americans are actually at increased risk for developing asthma. And of course, that's multifactorial. But in general, the point I would definitely want to get across is African Americans are at increased risk of asthma. Asthma in itself, having influenza with the history of asthma, whether it's mild or no matter what severity it is, actually increases your risk of having all types of, complications, including hospitalization. So again, keeping yourself healthy and getting yourself vaccinated, including the influenza vaccine, is important, especially with something, things like Flurona out there.
Your remarks harken back to the long days of 2020, when we were getting slammed with COVID, and then we're talking about influenza. And some of the basic rules for avoiding COVID were the same as avoiding the flu. Wash your daggone hands and cover your mouth when you cough. It seems like people, again, have been exposed because we don't do that. At least we haven't been doing it like we should. Let me ask the group, where do we go from here? I mean, we kind of know what's going on.
Yeah.
I want each one of you to pick an action step that you would recommend to individuals and their families and communities to protect themselves. Dr. Asia Harris, I want you to start.
I think what I would say to people, even though it sounds very basic, is you really need to know who you're around and what their possible risk factors are. As much as we like to think that we have a small circle, and as much as we want to kind of keep our exposure risk very low, the variant right now is showing us that we really need to know who we're around. As well as, I'll take it back to when I was talking about the nutrition, you need to also know what you're putting into your body. Even before the pandemic and coronavirus was around, we all had challenges of having a high nutrient rich diet as far as exposing our gut health to good vitamins and good minerals by the quality of food that we're taking in. And the pandemic has definitely showed that some people didn't have very good access to foods, and their nutritional statuses were low because they lived in food deserts, or they weren't able to transport themselves to grocery stores or gardens that they could get good food out of. And so I'll say, know who you're around, but also know what you're putting in your body.
Dr. Nancy Joseph, what's your action step?
So, Dr. Scott, my main action step would be, take care of you, take care of us. So a lot of, individuals are saying, may say, you know what, I'm healthy. I don't have asthma. So, maybe, if I got, whether it's, coronavirus 19 or I got influenza, I'd be okay. But however, help you, help us, right? Because there are those that are at increased risk. There are some loved ones that you have that are at increased risk. And, you may pass that on to them, whether it's the flu or COVID-19. A lot of people don't realize, even at the age of 6 months and up, you're qualified for the influenza vaccine. Now, there's different ones. Of course, there's, high dose for anyone that's 65 and up. And then, but 6 months and up, you can get the influenza vaccine. So protecting yourself, the influenza vaccine to help protect you from the flu helps protect the people you love. Same with the coronavirus 19 vaccine. So that's what I would say, help the community. Again, good hand hygiene is also of most important. Wearing the proper personal protection equipment is also very important. But, get yourself vaccinated, take care of yourself. And by default, you'll take care of the ones you love as well.
Thank you. And Dr. Effiong, what advice would you give?
Get your vaccine. The vaccine is safe. The numbers they don't lie. The vaccine is safe, right? But more importantly, the people bearing the brunt of these whole things are the ones without the vaccine. When you look at the numbers, compare those who've got the vaccine, the COVID vaccine, against those who did not get any vaccine, and those who have gotten their booster shots, it's just real. It's like day and night, right? When you see the number of people who are getting into the hospitals, right? Compare those who did not get the vaccines and who got the vaccines and those who got the booster, it's just day and night. Those who are dying, the same thing. So the vaccines are safe. Are there any side effects? Yes. No, there are no 100% safe vaccines, right? There are even no 100% effective vaccines, but these vaccines are very effective. And that very effective means by the time you look at those who have got vaccines and those did not, the difference is so much different between who's getting sick and who's getting hospitalized and who's going, who's losing their lives. And very importantly, what Dr. Joseph said, we've got to get beyond the point of me. That is one thing that COVID has revealed. Right? Mm-hmm. There's a lot more beyond me. There's us, right? And that's what getting your vaccine does. It protects you, but more importantly, protects the people around you, because you don't get sick. You don't get to jam up the emergency rooms. You don't get to jam up the hospitals. You don't get to prevent someone who needs that bed from getting that bed because you are ill. So please get your vaccines.
Yes. I guess the thing I have is a question, and that is, not a question, but a statement. I think as healthcare professionals, we need to admit defeat because we have not done enough to get our message across, understanding that people have lost faith and trust in what we have to say for whatever reason. We need to retool our message to be more effective. Dr. LeNoir, what do you think?
I'm not going to let this panel get off this easily. I mean, I've got a bunch of questions that haven't been answered. First of all, I'd like to ask Dr. Harris about the fact that some of these foods that boost your immune system cost a lot of money. And a lot of people don't have that kind of money. Sometimes they don't even have grocery stores. I'd like to ask Dr. Joseph, that everybody talks about the fact that people with allergy are at risk for getting this shot. What are the statistics around that? Like, if I want to ask you, people tell me, they say, people getting vaccinated, they still getting infected. What is that all about? And every time you look around, there's another booster. And if we look at the flu shot, you're not even sure with the flu shot sometimes whether or not they actually get the right flu. And a lot of people say every time I get the flu shot, people get the COVID shot, I know somebody who dies. How do you answer these people? How do you answer these myths? Let's look at just one or two of them. One is the fact that the COVID vaccine causes you to be sterile, causes pregnant mothers to have bad babies. What about those studies? And what about allergy as it relates to COVID infection? Dr. Harris, are you sure about these foods? Is that enough to get you over the hump when it comes to protecting yourself against the COVID virus? And how are you going to pay for these foods? And Dr. F. Young, how are you going to answer some of these criticisms and some of these myths?
So you answer the questions with science. Now, like I said, I started the discussion with, I know you don't trust science. You've got a good reason not to trust science. But here is where we are. We've gone beyond the point of mis-science. What we did in Tuskegee was not science. That was diabolical. We've gone beyond that. We've mended our ways and we're doing true science now. And now we've got the answers. The science shows that the vaccine doesn't cause sterility in men. The science shows that the vaccines, getting vaccinated, actually prevents a pregnant woman, puts a pregnant woman at the better in a better position, because as we know as doctors, that pregnancy is a high stress state. And the last thing you want to do to a pregnant woman is get her ill with anything, give her a virus, and then you could be talking about losing the baby or losing her life. The numbers are real. Women who get pregnant, get the vaccines, tend to fare better than those who don't. That is the science. You look at those numbers and you compare them, apples to apples. You run statistical designs and you see that, look, this is for real. And so the science is clear. Are people worried? Understandably, yes. Are there side effects? Yes, but those side effects in the vast majority are mild. Even when the vaccine causes, or people get the vaccine and they end up with like an inflammation of the heart, we understand why, right? Because when you get the vaccine, you create an immune response. And sometimes that immune response gets a little bit, more than you would want to see. And that happens in maybe young men who get some heart inflammation. But in a couple of weeks, they're fine. I would rather get heart inflammation than be dead. That is why I would get the vaccine.
Dr. Joseph, what about the allergy issues? I mean, people say that people with allergies shouldn't get the vaccine because they might have reactions. How realistic is that?
So what I would say is, unless you have a contraindication for the vaccine, and currently because of the PEG in the Pfizer and Moderna vaccine, that is the contraindication, history of anaphylaxis to that. But aside from that, in fact, getting protected, getting vaccinated is actually protective for someone with allergic diseases. Now, if you have an allergic disease, especially, something like asthma, we talked about how a viral infection, whether COVID-19 or influenza, can already be a trigger. So that increases your risk of having that lung inflammation, which then may increase your risk of, complications with that. And so getting vaccinated is important. Now, talking about allergies, in fact, research has shown a lot of individuals are doing fine with the vaccine, even if you were to get, a mild reaction, many individuals are fine with their second dose. And, you know, if ever you have any doubt, you can always contact or talk to your primary care doctor, who can send you to an allergist specialist such as myself. And we can kind of, you know, you can talk over your concerns or what has happened with the, let's say, first dose, and then go from there. But in general, many individuals do well with the vaccine. Even if you had a mild reaction the first time, a lot of people do well the second time, even if you have allergic diseases. And I want to also point out, Dr. LeNoir, allergic diseases are not a contraindication for getting the COVID-19 vaccine.
Harris, what about this food? I mean, what about these things you're recommending for people to eat in order to protect themselves against the virus? You know, we know that, in fact, when they always talk about we need to eat better, we need to exercise more. When most of the people in some of my neighborhoods, when they start running, they're running from something. And there's no grocery stores anywhere near them. So how much can that impact a tremendous infection like this?
So I do want to make it clear that the food and supplements that you take in are not going to like cure your COVID infection. It's not going to stop the course from happening overall. It's just going to make your immune system stronger at base, with the hope that you'll be better protected if you do get infected by COVID. Now, the supplements that people are taking, that they are trying to boost in that moment that they are infected, if you have a low amount of vitamin level in your system, whether it's vitamin D or C or something like that, then supplements are helpful. But if you have a normal amount and then you start taking supplements when you have COVID, that's not necessarily going to help you. And overdosing yourself with vitamins can actually be detrimental to your health. Now, the concern as far as access to food and food insecurities and food deserts that exist in our society, especially in African American communities, is a bigger picture than what someone can address next week or tomorrow. That's the health policy kind of concern, and people kind of going to their government officials and saying, we need this. Where's the money to contribute to our communities being more successful and having better health access and food access? I will say there are some creative communities that have placed food in more unconventional places that sell kind of other items, or they get people to outsource their food into these smaller facilities that aren't necessarily grocery stores, and they can help address someone's concern in the immediate sense instead of building a huge grocery store in these communities or waiting till that grocery store is built. I know that food is a hard thing to access for people, whether it's transportation or just quality food in general, but there are ways, and we really need to get ourselves at the table and figuring out how our communities and our cities are using these funds that could be used to build grocery stores and help people in their food insecurity problems.
Yeah, so I think we've established, I mean, these are questions that come up that I wanted to ask on behalf of some people in our audience. But Dr. Scott, I got a couple of questions for you. You talk about we need to be better at messaging. How much information do people need? I mean, we've gone over, Dr. Effion is right. We've gone over the science over and over and over again. We've seen these tremendous numbers of people who've been unvaccinated, who are filling up our hospitals, who are filling up our intensive care units. How much information? When is enough enough? I mean, I'm tired personally of talking about it to everybody that I meet about how it's affected the vaccine. The science is there. So I'm not sure that we are missing the messaging. Maybe the people who are getting the message need to do some things. A lot of them have never even taken science. And so consequently, I mean, how much information is enough information? And when are we going to stop saying that we understand your position? We tolerate the fact that you're pregnant and you're not going to get the vaccine, threatening your baby. We're going to tolerate you're not going to get your kids vaccinated, so they can't go to school and they spread it to your grandpa. And we're tired of the fact that you're not getting boosted, so you're not protected. When is enough messaging going to be enough?
Well, I would say that the amount of knowledge is adequate. I don't think it's a question of quantity. I think it's a question of quality, people who don't get vaccinated, in spite of the clear knowledge, are not thinking analytically. They're not using their left brain. 1 + 1 is always 2. But if you're afraid or you have misinformation, 1 + 1 is 22. And your brain informs your decision-making process. There are people who are listening to non-traditional sources of health information that they give more trust to than they deserve, so that when you as a physician or healthcare professional approach them, you have to not only make your point, you have to disprove someone else's point with bogus data. My response to you, Dr. LeNoir, is that we have to respect people's fears as we try to work around them and diminish them in order to lead them to health, whether it's by getting the vaccine, wearing a mask, or doing other things. And that's going to require some approaches that, frankly, I don't think physicians are trained to do. Some of us are by nature empathetic, but we've all been frustrated by our inability to move some of the population. Now, the majority of people who hear the data get the message. The problem is there's a hard percentage of people that won't do it for a number of reasons, and then it's not all about distrust of the government. There are a lot of reasons why they just won't do it, and we need to find a different approach to get them through, because data is not making the argument for them. I have to fight against being frustrated and discouraged every day when I see people who want to die on the hill of ignorance. And I had a classmate who's a cardiologist in Jackson. She's the first Black cardiologist in the state of Mississippi, who encouraged me by saying, you can never give up on these patients, because what you say today may not move them, but what you say tomorrow might. And there are people in communities who've taken up the cudgel, and they themselves, these are non-lay people, non-healthcare professionals who've gotten folks immunized who would never get immunized. So I propose that when I say we need to admit defeat, we are not moving 100% of the people to getting vaccinated. That's our goal. We need a multimodal method to do that. We need to be innovative and try different things to get people to goal, because it would help everybody. We might have to trick some people in a good way and not be deceptive, but use devices to get them to come to get vaccinated. That's really what I mean. There's no information deficit. You don't have to tell people if there's money on the corner, go get it. They'll run down there and there could be nothing. But they understand that message. But when people are afraid, they don't think rationally, they make misinformed decisions, and they're subject to misinformation from others, especially when it reaffirms or assures them of what they want to believe rather than what's really true.
Well, I think that this has been a very robust discussion. I've had to play the devil's advocate here to get some of the information out. I think we're all a bit frustrated by talking to our community, because we know exactly what's at stake. I do think that we've done a pretty good job as African-American providers of all types trying to get the information out. Yet we still have to understand that some people have fears, and some people have made decisions that are different from those that we may like. So I think just like for most everything else, from the barbershop to the classroom, we have to keep talking about what's going on. Obviously, you answered the question for me about vaccines for both COVID and influenza. Yes, they are important. Yes, they are impactful. I'm an old school pediatrician, maybe not too old school, but still old school. Old enough to remember the days of polio and pertussis, hepatitis, and smallpox. And we used to see patients, 50, 60, 70 patients a day. Now, because of the vaccines that almost everybody who is looking at our program and we're talking to has had at least 15 vaccinations by the time they are 13 or 14. But we don't want to condemn those who choose not to do so, because that would stop us from talking. So I'd like to thank each one of you. Dr. Harris, I do believe the diet makes a big difference in how you handle infections and what your immune system looks like. Dr. Effion, I share your frustration when we talk about the science and the fact that we're all in this together. And that if you don't get vaccinated, that means your grandpa might not. Well, I hate to say that. I mean, my grandpa, all my children, I made them get vaccinated because I didn't want to get the infection. But what you say is very true. There's a body of science. There's information. There's experience. And here's the other thing. The people that you're talking to, they've depended on you all of their lives, a lot of them. And you've had their back. And yet now it's time to get some information. Why shouldn't they come to you? They'll come to you for everything else. And certainly, Dr. Joseph, obviously you've kind of at least allayed some of the fears about the fact that if you're allergic with hay fever and sinus problems, that's not going to affect you getting this vaccination. And so consequently, it's a very robust panel. I'd like to thank the Department of Community Medicine of the National Medical Association, combined with the Allergy Department. I'd like to thank you, Dr. Scott, for leading this discussion. But most of all, I'd like to thank those people who took the time to look at our program and to remember that health is your biggest asset, so protect it. We'll talk again next week.